Right. So moving to the next condition, this is what is known as a vitamin K blood clotting related disorders. Vitamin K blood clotting related disorders. So for the vitamin K, that is needed for appropriate what do they call it, appropriate blood clotting and all of that. So like if it is deficient or if it is lacking, you now have a lot of problems, okay, that have to do with bleeding. So for this vitamin K related one, we say that vitamin K group of what, lipophilic, that's fat soluble, and hydrophobic vitamins, they are usually obtained from what, green vegetables. You always see the broccolis there, so you always get these essential guys from the food you eat, so they are also gotten from bacterial synthesis in the gut, all right, like K2 MENAP, also found in animal sources such as dairy products and fermented foods. So these are needed for post translation, that's stroke synthesis modification of proteins such as blood coagulation factors. So it is an essential cofactor for the enzyme gamma glutamyl carboxylase, which functions in the carboxylation of glutamic acid residues in the many vitamin K dependent proteins that are involved in blood coagulation. So you can see how vitamin K is actually so much needed. They'll mostly say that it's activate factor 2. All right, so it's needed in activating these proteins that are needed for blood to clot. We are now stating its function so that we'll now state its deficiency, why there will be some complication in its deficiencies. You just know why it actually exists. So it catalyzes the carboxylation of what, amino acids, that's glutamic acid, to gamma carboxyglutamic acid. So vitamin K dependent gamma carboxylation occurs only on specific glutamic acid residues, all right, in identified vitamin K dependent proteins, all right, and it's actually crucial for their ability to be able to bind calcium. So the ability to bind calcium is required for activation of several vitamin K dependent clotting factors or proteins in the coagulation cascade. So imagine vitamin K is now deficient, so the actions of these guys will be greatly reduced, which will not be good for life. So this is just trying to show, all right, here is also trying to show the vitamin K cycle, which we have already spoken in depthly on it back then in our biochemistry days. All right, so it is actually gotten from food sources. All right, so what is the causes of vitamin K deficiency? All right, so you can also have vitamin K deficiency bleeding, formerly known as hemorrhagic disease of newborn. All right, so sometimes it's what, biliary obstruction. All right, so sometimes could be that you are taking vitamin K appropriately, but the absorption is not optimal. You understand? So things like what, tropical spiral, gluten-induced enteropathy, the vitamin K antagonist therapy. So you are taking some drugs that don't really favor vitamin K at the moment. There's sometimes liver disease, so complex dysregulation with synthetic failure, pro and anticoagulant factors. There's sometimes disseminated intravascular coagulation, like that one, but blood clotting is too much to the extent that like you are consuming all the clotting factors, consuming all the platelets. So if vitamin K is there and is needed for clotting factors, you are even consuming the vitamin K, or so this is just the linkage between vitamin K and blood clotting factors disorders. This is a linkage.